Do you sometimes have intrusive thoughts or sudden recollections about your injury? Or maybe you feel emotionally numb or distant from other people? Do you avoid situations or settings that remind you of your injury, like riding in a car or participating in a particular sport? Do these symptoms interfere with your ability to work or engage in previous social activities? If you find yourself answering yes to all of these things, it might be worth talking to your doctor or therapist about the potential for having post-traumatic stress disorder, also called PTSD. Not everyone who has a traumatic brain injury experiences PTSD. And although this may sound strange, it is really only those persons that have had milder brain injuries who are at greater risk for experiencing PTSD related to their brain injury. This is because a critical and necessary condition for being diagnosed with PTSD is remembering and re-experiencing the traumatic event, in this case, a brain injury. Some people will be unconscious for the actual brain injury event, but may awaken to find themselves in a very emotionally traumatic situation. This sometimes happens when people have been knocked unconscious in a car accident and then awaken during rescue procedures. A situation like this is likely to be very frightening. Not everyone who has a traumatic emotional event related to his or her injury will develop PTSD. Also, PTSD symptoms usually develop very soon after an accident. So if it has been several months since you were injured and you are not having symptoms of PTSD, then you are unlikely to ever develop it. But if you do find yourself experiencing some of the symptoms that I have mentioned, it is important to have these evaluated by your doctor or mental health professional. An appropriate evaluation and diagnosis is important because there are many other things that can mimic some of the features of PTSD. For example, many types of anxiety disorders overlap significantly with PTSD. Depression also may have some overlapping features. Because different conditions are treated in different ways, through therapy, medication, or both, it is important to try not to diagnose yourself, but to get an objective evaluation and determination of your symptoms and what they might mean. PTSD symptoms typically improve over time, and in milder cases can even improve on their own. But it is very difficult to predict who will recover quickly and who will have persisting symptoms. But the good news is, there are effective treatments for PTSD, including PTSD among persons with TBI. Most of the therapy and medication interventions for PTSD in general are also effective for PTSD after TBI. In some situations, however, talking therapy for PTSD following TBI might require some modification if you are having difficulty with attention, memory, or other aspects of thinking. Because of this, it is a good idea to seek mental health care from someone who is knowledgeable about both PTSD and traumatic brain injury. Your doctor or the VA can be very good referral sources in this regard. The most important thing to remember, however, is to seek help as soon as you notice any bothersome symptoms. You can use the IntelaCare health tracker to document your symptoms so you can share them at your next appointment. While dealing with anxiety-provoking memories can be difficult, it is the first step in a successful recovery.